Hello everyone, I am Dr. Mrcpch and I am excited to introduce the orientation session for the Mrcpch clinical exam. So in this video, I will break down the exam structure, explain the marking system and share the essential tips to prepare for this exam efficiently. So I hope by the end of this session, you will have a clear roadmap of what to expect and how to approach the clinical exam. So what exactly is this clinical exam? So this is a basically is a practical skill based exam that will assess how well candidates handle real life pediatric cases. This exam is different from the written exams, that is the theory exams, as it tests how you interact with the children, take histories and perform physical examinations and communicate with the parents and the other healthcare professionals. So who are actually eligible for this clinical exam? So in any candidate who has passed all the theory exams, that is FOP, TAS and AKP. So you have to pass all these 3 theory exams, then you will be eligible for the clinical exam. So what is the main aim of this clinical exam? So Mrcpch actually tests the candidate in effective communication skills and establishing a rapport and history taking and management planning and physical examination and the clinical reasoning, child development and recognition of the acute illness, and the professional behavior will be tested in all the stations of the clinical exam. So let's see the format of this exam. So these exams are held in the hospital centers across the UK 3 times a year and also held overseas at various points in the year. So these are called as exam diets. So in the UK they are held in 3 times a year, that is in the month of Feb, June and October, and in the overseas it's held according to the overseas host availability. So how does this exam differ from the undergraduate OSCE exams? So in many UG OSCE exams, marks are awarded for each task performed according to the yes or no checklist. Whereas in this exam, this requires not only correct process but also the ability to identify the clinical signs and also give the clinical reasonings. So domain marks will be used to generate a total score for the candidate. So the total score will be compared against the exam cutoff score to allocate an overall pass and fail grade. So what is this exam circuit? And let's see the stations in this exam circuit. So this is called as Mrcpch clinical circuit. So it has 10 stations. So candidate has been tested in these 10 stations. So the station 1, it starts with the clinical station, and station 2, 3 and 4 also clinical stations. So these are the clinical stations, first 4 stations of the exam circuit, and followed by the developmental station. So there are 2 developmental stations running in parallel, either red or blue. So the candidate will be given either red developmental station or blue developmental station. and both these two stations have got the same scenario. Okay, you will be given either one of them, and followed by the station 6, that is the history station. These are also two stations which are running in parallel, so either red or blue. Candidate will be given either red or blue. Followed by the communication station, that is the communication station A, and communication station B, that is the station 8, and station 9 and 10 are video A and B. Okay, this is the clinical circuit. Suppose if the candidate starts with clinical station 4, so the candidate will go through the developmental station, followed by the history, then communication A, communication B, then video A, video B, followed by the clinical station 1, 2, 3. So the circuit ends with station 3. Okay. So there will be one examiner per station. Candidates will be assessed by the different examiners at each station. So each candidate has to face 10 examiners because there are 10 stations. So in total there will be 12 examiners for each circuit. One additional examiner will be there for the quality assurance and the backup. So 12 candidates can be examined each day. At each session, that is 12 candidates in the morning session and 12 candidates in the afternoon session. So total there are 24 candidates per day. So one candidate will be placed in every station of the circuit. Development and history stations are two stations, and they will begin their rotation through the circuit from that point, making 12 candidates in total. So 2 candidates at the history station and 2 candidates at the developmental station at any one time, red or blue. So both the stations are 22 minutes in length, so the other 8 stations are 9 minutes long. So before each stations you will have 4 minutes break before each station. So you can do the preparation time during this time. So the entire duration for this exam is 160 minutes. That's around 2.5 hours. So the initial 4 stations, that is the clinical stations, they have the real patients. So you need to examine the real patients in the clinical stations. Whereas the history, development and communication stations, they have the role players. So this history, development, history, communication, video stations are all scenario based, and for the video station, equipment like the laptops with one video clip will be provided for the video A, and one video clip will be provided for the video B. So let's see the marking scheme for the clinical exam. So there are 41 domains that are marked across the 10 stations. So each domain has maximum of 2 marks. So the total marks available are 82. So if the candidate is unprofessional under this exemption circumstances, examiners will have an additional domain of professional conduct in the marking sheet. So candidates will not necessarily fail based on a single encounter, but will be assessed on an accumulation of the marks. So the marks will be awarded within the following domain. So domain A, domain B, domain C, domain D and domain E. So domain A is A1 is about information gathering, and A2 domain is about information giving, accuracy of information, and domain B is about physical examination, and C is about identification of the clinical signs, and D1 is about clinical reasoning, D2 about management planning, and E1 is rapport and communication style, and E2 is verbal and non-verbal communication skills, E3 is managing concerns. So not every domain is tested in every station. So these domains are tested across all the stations. So that is of 41 domains are tested across all the stations. So the maximum mark for each domain is 2 marks. If the candidate meets the standard for that domain, so the candidate will be given 2 marks for that particular domain. If the candidate is average for that domain, he or she will be given the borderline marks, that is 1. And if it is below standard, the candidate will be given 0 marks for that domain. So this is how the domains are split across all the 10 stations. So information gathering, that is A1, is tested across the developmental and history and management planning 2 stations, and A2, that is information sharing and accuracy of information, is tested in communication A and communication B. So total available is 4 marks for it. And domain B, that is physical examination, is tested in all the 4 clinical stations. So all the 4 clinical stations plus the developmental station. So total 10 marks for domain B. And domain C, that is identification of the clinical signs, 14 marks. So this is tested across all 4 clinical stations and also the developmental stations, and identification of the signs also is tested in video A and video B. And the clinical reasoning, domain D1. So clinical reasoning has a maximum marks, that is 16 marks for this domain. So this domain is tested across all the clinical station plus developmental station and also history station, and all as well as in the video stations A and B. So D2, that is management planning, tested across again all the clinical stations plus development plus history stations and the video stations, and it also has a maximum marks of 16. And rapport building and your communication style, how you communicate with the patients and the role players, that will be tested in the developmental stations, history station, and in the communication skills. It has about 8 marks. And E2, that is your listening skills. You have to be very patient to the role player, and you have to be very empathetic to the patients, and that will be tested in your history and in your communication A and B. It has about 6 marks. And your managing concerns and agreeing for the next steps is tested in the communication A and B, that is total of 4 marks. So the total domains, the maximum marks is 82 marks. So for each station, so clinical has 8 marks for each station, and development has maximum of 12 marks. Highest station is the highest marks, and easily you can score in the developmental station. And history station 10 marks, and communication has 8 marks each, and video station has 6 marks each. So below standard will get 0, borderline will get 1, and the candidate who meets the standard will get maximum of 2 marks for that domain. So the minimum pass mark to pass this exam is 62 out of 82 available marks. There is a pass percentage should be about 76.8%. So this is really not easy job. You have to practice a lot for these exams. If the suppose if a candidate gets marks of 52 or below, then this will result in automatic deferment for the next tithe. So it means that, for example, if you were to receive a deferment score of 52 or below for the 2025 Diet 1 exam, then you will not be eligible to sit in 2025 Diet 2, but can reapply to sit in 2025 Diet 3. This is called as automatic deferment. So if you compare the time and the marks for all the stations, so clinical station 1 to 4, each station has about 9 minutes and maximum of 8 marks. So developmental station, it has a longest station, that is 22 minutes, and it is a total score of 12 marks. So 12 marks. So this station is very easy to score and very easy, and though it is lengthy, it is very easy to score in the developmental station. And history station, that is there, also has 22 minutes and it has 10 marks. And communication station A and communication station B, each station has 9 minutes and 8 marks each. And video station A and B, it also has, each station has got 9 minutes and this station has each of 6 marks. So what to do on arrival at the center? So you have to plan your journey to the center in advance and ensure to check the details of the building where the exam is scheduled to take place. So the candidates will be either be booked for a morning session or an afternoon session, and you should reach the center at least 1.5 hours before the exam circuit. So upon arrival, the host staff will register candidates and he'll request to see the admission document and ID card, and once the ID is checked, staff will provide candidates with a set of mark sheet. So you will be given 10 mark sheets for the 10th station, and also you will be given your personalized route map, which is different for different candidates. Suppose your circuit can start from clinical station 3 and followed by clinical station 4, developmental station, then the history station, then communication A and then communication B, video station A, video station B, then the clinical station 1, followed by the circuit ends with clinical station 2, as I explained before. Okay, so this for some of the candidates it can start with history station, for others it can start with communication station, and it will follow that circuit. So each candidate will be given their own personalized route map. So you have to review the route map and you have to arrange the mark sheet for each station according to that order in the personalized route map. So candidate will be asked to add your candidate number. This candidate number will be there in your admission document, and also you need to write your name to the mark sheet using the pencil. Always you have to use pencil. The pencils will be provided at the center itself. The exam teams, they are unable to scan with the pen marks, so never ever do the shading with the pen marks. So once the mark sheets are filled in, correctly ordered, candidates should wait in the waiting area. Then the senior exam will arrive and he'll do briefing before the exam begins. He will explain you about all the stations and about the exam circuit, and if you have any questions you can ask to the senior exam at this time during the briefing. Once the exam circuit begins, you will not be allowed to take the break or use the restroom when the circuit begins. So you have to take the toilets before the exam circuit begins. So what's the timing for the examination? So all the candidates can expect to be examined for the full allotted time. There sometimes will be occasions where candidates will finish the stations very early. So if this occurs, the candidates have may wish to inform the examiner that they have finished and they have nothing additional to add, and the examiner may check whether they have finished. If finishing early, then the candidate, examiner and the patient or the role player, they should remain seated in the station until the end of the station. So it's always better idea not to finish the station early. Always use the time given appropriately. So the timings are very strict. They do the very strict timekeeping. So sometimes delay will happen, especially in the clinical station if the patient is not cooperative. So at that time the circuit may need to be paused, and very rarely it happens. So if that occurs, you need to stay calm and then focus. You need not become anxious. Okay. So as explained, this is a face-to-face normal circuit. So let's see the breakdown of each exam station. So initial first 4 stations are clinical stations. So clinical stations 1 to 4. So the aim of this clinical station is to assess the correct examination technique and interpretation of the clinical science and give the clinical reasoning. There is only one patient at each station, and there will be a separate examiner at each station. Okay. So the candidate information is each candidate will be given a brief introduction to each child and the task required. Okay, this will be provided verbally by the examiner and is not provided in any written format. So during this station, what happens is the candidate is supposed to wait outside the station for about 4 minutes, and after 4 minutes the candidate enters the room, and there the examiner will introduce himself and greet the candidate, and he will give the task verbally to the candidate. So candidates are not informed of what system focus will be for each of these 4 clinical stations until they enter the room. So on entering the station, the candidate will greet the candidate, the examiner will greet the candidate and take the correct mark sheet for the station. So it's better to keep the correct mark sheet ready so that you give the correct mark sheet to the examiner at each station. To avoid wasting time looking for it after entering the room, so the candidate is then introduced to the child or the parent and provided with the task verbally. The task will be given verbally, and there will be no any written format for this. And the examiner may ask about the technique of the examination and the findings and any issues related to the interpretation. Okay. If the candidate does not understand the task, the candidate can ask the examiner to repeat it. Where a candidate has completed their assessment quickly, or when a child is not cooperative, the examiner will give you the further instructions. So there will be warning at 6 minutes in the station to indicate that the 3 minutes are left. In the last 3 minutes, you need to summarize your findings, and then the examiner will discuss about the the case. So this is the flow chart for the clinical station. So the first 4 minutes there is you have to wait outside the station, and there is no candidate information sheet for the short clinical station. So after 4 minutes the candidate will enter the room. So once the candidate enters the room, the examiner will introduce self, parent and patient and the parent. So the examiner will provide the introductory statement very briefly. So there will not be a scenario, but very briefly he will give the introduction about the case, including the system and the task. So examiner will ask the candidate to conduct a focused examination. Suppose for example, the examiner can tell the candidate to do the lower limb examination for the CNS case, or he might ask you to do the upper limb examination for the CNS case. So depends. Okay, and the candidate will do the relevant examination after greeting the taking the consent from the parent and greeting the patient and the parent. So after finishing the examination, so there will be knock at the door at 6 minutes of the station. So then the examiner will ask the candidate to briefly summarize the key clinical signs they have elicited. So the candidate is supposed to summarize the findings and give the clinical reasonings for the clinical findings to arrive at the accurate diagnosis. And the candidate will provide the interpretation of the signs and the signs, and give the most likely diagnosis, and also give the 3 or 4 differential diagnoses. And the examiner can ask the questions about the complications, about the investigations and the management. Okay, and the candidate has to respond to the questions and give like brief answers. You need not explain everything in detail because the time is very less. You need to give time to the examiner so that he can ask the questions more. So at the total station is for about 9 minutes. So at the end of 9 minutes, helper will announce that the station is over and the candidate will move to the next station. Clear? So in this clinical station, the candidate will be given either the CVS system or the system related to the neurology, musculoskeletal, respiratory, abdominal, gastro, eye examination, and dermatology, hepatology, hematology, growth and nutrition, like short stature is most commonly asked sometimes, and nephrology and other syndromes like the Down syndrome is most commonly kept in the exams for this clinical station. So the examiner will give you the task verbally, like for example, this is Anita. She is 14-year-old and has difficulty walking. Can you please undertake a peripheral neurological examination? So other example is, this is Nayan. He is 11-year-old and has chronic kidney disease. Please can you examine his abdomen? And you will be given, like, this is Richard. He is 7-year-old and has been referred by his GP after finding a murmur during an examination for the chest infection. Please examine the CVS system. So this task will be provided by the examiner verbally. So during these clinical stations, examiners are looking for an organized and structured approach, and you have to follow a very clear and systematic pattern. And so examiners are actually looking at the candidates to see if the candidates have done this technique before. So this is the expected domain standard for the clinical station. So the candidate will be marked against the clinical domain B, C, D1, D2. So the 4 domains. So each domain has a maximum of 2 marks. So total 8 marks for this station. So in domain B, the examiner will see how you are doing the structured approach for the physical examination, whether the candidate meets the standard, if he has well structured systematic exam technique, appropriate recognition of the requirement of the care taken to adapt to the needs of the patient, including permission to examine. You have to wash your hands, hand rub will be provided, you need to rub your hands, introduce the examiner, introduce yourself to the examiner, to the patient and to the parent, and take permission and the consent from the parent to examine the child. And also the examiner will see if you are using the appropriate equipment and developmental toys, and if relevant. And domain C, that is identification of the clinical signs. So the candidate will meet standard if he identifies the clinical signs that are present and do the correct clinical reasoning. And domain D1, that is clinical reasoning, that is formulates and proposes likely appropriate differential diagnosis, and understands the implication of the findings and able to suggest appropriate steps if okay. And D2 is management planning. So in management planning, the candidate will tell the relevant investigation to appropriately address the identified problems of the patient, and also provide safe, ethical, effective management plan that relates to the parental concerns if relevant, including appropriate referral or escalation to the specialist. So these are the mark sheet for the clinical station. The clinical station 1, you need to enter the candidate number here, and suppose if the candidate number is 173, you need to write this number 173 here and do the shading in this 173 with a pencil. Okay, and write the candidate's number here and date, time like AM or PM, morning or the afternoon session, and the candidate will be given marks in the domain B, C, D1 and E1. Total 8 marks for this station. So this is the mark sheets for all the clinical stations. So the tip for the clinical station is you have to be very systematic and start with the general observation, and then inspection, palpation, percussion and auscultation. You need to be basically should have a very structured approach for every system. So the next is station 5, that is development station. So there are 2 developmental stations running in parallel in each exam circuit, that is either red or the blue. So each candidate will be assessed in only one of them, either red or blue. So both the red or the blue stations will have the same scenario. So here the aim of the station is to assess the candidate's ability to take a focused developmental history from the role player. First, initially you need to supposed to take the developmental history from the role player and describe how they would undertake an assessment around the key areas of the development with the examiner. So here the developmental assessment is a verbal assessment with the examiner. There will not be any patients or there will not be any child for the assessment. It's only the verbal assessment with the examiner. So you have to take the history, developmental history from the role player, and do the verbal assessment from the examiner. and at the end you need to integrate these findings to come to the diagnosis, and also give the clinical reasonings and address the impact on the child and the family. So there will not be any patient in this station, and there will be a role player in this station. So for the candidate information, each candidate will be given a candidate information sheet. So when the candidate is waiting outside the station, the candidate information sheet will be provided that will clearly state the background information and the task required. So this will be provided before the start of the station, and universal cues related to the scenario, for example like the photos, growth charts, audios or videos if required will be provided. Okay, so the candidate will have a time of around 3 to 4 minutes to read the candidate information and review any cues. If the candidate does not understand the task, then the candidate may ask the examiner for the clarification. So once the candidate enters the room, the examiner will greet the candidate, and the candidate will give the correct mark sheet to the examiner. So the candidate is then introduced to the child and provided with the task by the examiner. So the examiner might ask about the technique of the developmental assessment, the findings and issue related to the diagnosis. So the candidate information sheet will clearly state the developmental area or the task in each station. So the examiners will ensure the candidates are clear about the focus of the assessment. Candidates will be presented with a scenario about the patient whose developmental difficulties will be in any one of these 4 domains. So you will be given a task to do the gross motor assessment, or the fine motor, or the speech or language, and social or communication. Sometimes you will be given a task of do the cognitive assessment for the child. In that case, you need to do both the speech and language and the social and communication assessment. So this is the development station flow chart. So the first 4 minutes the candidate will be waiting outside the station. So the candidate will read the candidate information sheet. So candidate will review any audio, videos or photo or the universal cues if provided. So after the 4 minutes, candidate will enter the room. So once the candidate enters the room, examiner will introduce self and the role player. Examiner provides introductory statement, and then examiner will ask the candidate to take a focused history from the role player. So the candidate will take the history. At 6 minutes, there will be a warning knock at the door that 3 minutes are left. So the total 9 minutes you have to take the history from the role player. So 9 minutes is for the history, developmental history from the role player. So after 9 minutes, you need to summarize the history in 1 minute. You have to practice this very thoroughly to summarize the entire history in 1 minute. So in next 9 minutes, the candidate will supposed to do the developmental assessment in the next 9 minutes. So the examiner asks the candidate to describe step by step the process of how they would undertake a developmental assessment. So the candidate will describe the developmental assessment process. This is the verbal assessment. So the examiner will act like a child. The examiner will provide the dependent cues to the candidate during the assessment process. After assessment, the examiner will ask the candidate to briefly summarize the key developmental signs they have elicited. So the candidate will briefly summarize the key developmental signs. Then the examiner asks the candidate for the clinical reasoning of the signs, what they have seen. Then the candidate will provide the interpretation, and the helper will warn the door that 3 minutes are left. So in the next 3 minutes, the examiner will discuss the ask about the diagnosis and differential diagnosis. The examiner can also ask the questions related to the complications, investigation and management, and the total time is 22 minutes. And at the end of 22 minutes, the helper announces that the station is over and candidate will move to the next station. So first you need to take the developmental history from the role player and do the developmental assessment. Here the child will not be there, and the examiner will act as a child, and you have to do the verbal developmental assessment. So the suggested toys and tools will be provided at the station. So the candidate will be expected to outline the main areas of the management and demonstrate the knowledge of the roles of the members of the multidisciplinary team dealing with the child development problems. So the examiner can ask you, so what is the role of occupational therapy, what is the role of the social worker, what is the role of the educational psychologist, so, and all the multidisciplinary team. So you have to be very thorough about this team and know their roles. So this is how the task will be given to the candidate in the candidate information sheet. So for example, Joe is 4-year-old. He was born at 25 weeks gestation and has cerebral palsy. Please take a relevant developmental history. And during discussion with the examiner, your approach to clinical evaluation of the nose, fine motor skills will be assessed. Okay, so this is how the task will be given to the candidate. So the examiners are looking at the candidate, if the candidate is able to assess the likely etiology, like whether the candidate is asking in detail about the perinatal history, prematurity, birth history, chromosomal disorders, and about the significant past history to arrive at the diagnosis. And the most important thing is the impact of the child's difficulties on the family, whether the family is getting social support and additional help, and educational healthcare plan if the child is receiving, and the team involved will be discussed. So in all the stations, candidates can make notes during the station, but they must leave these notes in the room before they go to the next station. So the candidate will be marked in these 6 domains. So 2 marks for each domain, so total of 12 marks. So the A1 is information gathering. So candidate will meet the standard if he asks key relevant questions and very sensitively gathers information and explores the main problems. And domain B is physical examination. Candidate will meet the standard if he or she is well structured, systematic in exam technique, appropriate care taken to adapt to the needs of the patient, and taking the concern from the parent and the examiner, and use of the appropriate developmental toys. And domain C is identification of the clinical signs. The candidate will meet the standard if he identifies the clinical signs that are present and correctly interprets the clinical signs that are present. And D1 is clinical reasoning, that is formulates and proposes likely appropriate differential diagnosis and understands the implications of the findings and able to suggest appropriate steps if exam inconclusive. So D2 is management planning. Candidate will meet the standard if his if he says the relevant investigations to appropriately address the identified problems, provide safe, ethical and effective management plan that relates to the patient or the carer. And E1 is communication skills, rapport and communication style. Appropriate level of the confidence will be checked, and greeting, introduction, candidate's attitude, professional appropriate body language, and response to verbal and non-verbal cues. All this will be observed by the examiner. Okay, so this is how the mark sheet of the development looks like. Here will be the candidate number, candidate's name, date, and this will be marked by the examiner, that is A1, B, C, D1, D2, E1. So the tip for the developmental assessment is you have to be very familiar with the milestones, and you should be very thorough with the age appropriate development. Practice the developmental milestones every day till you give the exam. So let's see the station 6, that is the history station. So history station is for about 22 minutes. So there are 2 history stations running in parallel in each exam circuit, that is either red or blue. So each candidate will be assessed in only one station, that is either red or blue. So when the candidate is waiting outside, a candidate will be given an information sheet about the candidate's role and the clinical background of the patient. It's often in the form of a letter to the candidate asking them to see the parent or the adolescent. That is, here there will not be any patient in the station. The task is the role player. The role player will act like a parent or the adolescent. So the instructions will be provided to the candidate when the candidate is waiting outside the station for about 3 to 4 minutes. So the candidate will be expected to take a focused history of the child or adolescent's problem from the role player. So the time for the history taking is 13 minutes for the history, taking the focused history from the role player. The remaining 9 minutes will be the candidate is supposed to summarize the history and discuss the management plan with the examiner. So after the role player leaves, so after the end of at the end of the 13 minutes, role player will leave the room, and the examiner will discuss the case and its management with the candidate. So this is the flow chart for the history station. So the candidate will be waiting outside the room for 4 minutes. At that time, candidate will be given the information sheet. At the end of the 4 minutes, candidate will enter the room, and the candidate will take the focused history from the role player, and the time is for 13 minutes. So after entering the room, the examiner will introduce self and the role player. Examiner will provide introductory statement very briefly, and examiner will ask the candidate to take a focused history from the role player. The candidate will take the history from the role player. At 9 minutes, helper will announce the warning bell that 4 minutes are left. So at the end of the 13 minutes, helper will announce the end of the history taking, and the role player will leave the room. At the end of the 13 minutes, and the rest 9 minutes, candidate has to summarize the history properly and discuss the management plan with the examiner. So the total station is for about 22 minutes, same like the developmental station. So in the history station, the candidate will be marked against the domains A1, D1, D2, E1 and E2. So A1, the maximum marks is 2 marks for each domain. So total 5 domains, so there is total 10 marks for the history station. So candidate will get the full marks for the A1 domain if the candidate asks the key relevant questions. Candidate is very sensitive in gathering the information and explores the main problems, concerns about the parent, patient in a very structured manner. And D2, that is the clinical reasoning. So candidate has to formulate and propose likely appropriate differential diagnosis. You have to give most likely diagnosis and at least 3 to 4 differential diagnosis. And candidate has to understand the implication of the findings, able to suggest appropriate steps if exam is inconclusive. And next domain is D2. In D2 domain, that is for the management planning. So candidate has to know the most likely diagnosis and suggest the investigation appropriately according to the patient's problems, and suggest the effective management plan. And even domain, here even though it is a history station, there is a domain mark for this communication skills and rapport and communication style. So for this there is 2 marks. So the candidate's appropriate level of the confidence, greeting, introduction, and the concern and the rapport all will be taken into consideration for allotting marks in this domain. And E2 will be for the verbal and listening and communication skills. So candidate has to be very patient and actively listening to the role player, and he should give an opportunity for the role player to speak, and you should avoid any kind of medical jargon questions in this history station. If you use the medical jargons, you will definitely get a negative marks. So this is how the mark sheet for the history station. Here you need to enter the candidate's number and shade here, and here you need to enter the candidate's name, date and time, and here the examiner will mark against this domain A1, D1, D2, E1 and E2. So the tips for history station is you have to be actively listening, and you should be very patient and summarize the key points of history, focused history in 3 to 4 lines maximum. And you have to structure your management plan very logically, giving it the clinical reasoning. So the next station is station 7 and 8, that is communication station. So there are 2 communication stations, that is communication station A and B. Each has 9 minutes. So the aim of this station is to test the candidate's ability to communicate appropriately and factually correct information in very effective way. And this station does not have any kind of patients or the parents. The task is usually with the role player. So candidate information will be given in the candidate information sheet. Written information will be provided about the candidate's role and the clinical background and the task required. So candidate will not be required to examine a patient. Information including the growth charts and results of the investigations may be provided if relevant. And candidate will be marked basing upon the communication skills. And here the examiner will not ask you any kind of questions. And candidates needs to select the most appropriate information to communicate, provide information that is very correct, and explain the issues in a very appropriate way and without using any kind of medical jargons. If any candidate use medical jargons, then that candidate will get negative marks. So better to avoid all kind of medical jargons, and always adapt to the emotional context of the station. Suppose if you are providing information regarding any newborn, and it's better to start with by congratulating the parents, and you have to be very empathetic and adapt yourself to the emotional context of the scenario. And it is not the test of the amount of the information conveyed in the 9 minutes. So your your communication skills will be observed by the examiner. So there are 6 main patterns of the communication scenario, that is the information giving and breaking bad news, taking the concern from the role player, and reporting the critical incident, and ethics, and educating a medical student. So this is the communication station flow chart. So the first 4 minutes. So this is the communication flow chart, that is the first 4 minutes. Candidates will read the candidate information sheet, and at the end of the 4 minutes, candidate will enter the room, and here the candidate will greet the examiner, and examiner also will introduce self and the role player, and examiner will ask the candidate to begin the station. The candidate will undertake the discussion with the role player, and there will be a warning knock at the door that the last 3 minutes are left at the end of the 6 minutes. So at the end of the 9 minutes, helper will announce that station is over and candidate will move on to the next station. Here examiner will not ask any kind of questions to the candidate. So you will be marked against the clinical domains A2, E1, A2 and E3. So each domain has about the maximum 2 marks. So this is maximum of 8 marks. So A2 is information sharing and accuracy of information, that is your candidate explains the relevant and clinically accurate information, never provide the false information to the role player. And E1 is communication skills and the communication style and your body language, use the appropriate body language, and respond to the verbal and non-verbal cues, and always develop a appropriate rapport with the role player. And suppose you have to use an appropriate tone. Suppose if your task is about the breaking bad news, always lower your tone and keep your voice very low. And wherever possible, you should do the drawings. You will be provided an empty sheet, so you can use that sheet to make a drawing. Suppose for example, you are explaining about take the consent regarding the lumbar puncture. You can just draw the drawing of the CSF and the spinal cord and the needle. Here you are going to insert the needle between L2 and L3 bone. You can explain that to the role player with the help of the drawing. So wherever possible, it's better idea to do the drawing. And E2 is verbal and listening skills. You have to be very patient and actively listening to the role player, and always allow others opportunity to speak. You need not keep speaking for a long time. Don't speak more than 30 seconds. So that is the tip for this station. Okay. And E3 is the managing concerns and agreeing for the next steps. So if you don't know about that, if you're not aware about the task, and if you're not sure about the information, then you can just say to the role player that you will arrange a meeting after discussing with the consultant or the senior. So this is how the mark sheet of the communication looks like. Here is the candidate number, candidate name. You have to enter the date and time. So examiner will mark you against the domain A2, E1, E2 and E3. So 8 marks is the maximum marks, and the timings is 9 minutes. So the tip for this communication scale is always avoid medical jargons, because using medical jargons will just result in the negative marking. Okay, and you have to be have an appropriate body language and use empathetic language and adapt to the emotional context of the scenario. So the next station is station 9 and 10, that is video stations. There are two video stations, that is video A and video B. The main aim of this station is to assess the candidate's ability to make clinical observation and identify the correct clinical signs. So acute signs seen in emergencies can be kept in these stations. Sometimes the video clips may be accompanied by the sound. In that case, headphones will be provided. So this is the video station flow chart. So the first 4 minutes, candidate will be waiting outside the station. Candidate will read the candidate information sheet, and at the end of the 4 minutes, candidate will enter the room, and the first 3 minutes after entering the room, examiner will introduce the self, and examiner will provide introductory statement briefly. Candidate will view the video clips as many times as they wish during the first 3 minutes of the station. So you can watch the video as many times as possible. You can rewind the video and watch it again and again in the first 3 minutes. So at the end of 3 minutes, there will be a warning knock at the door. So in the next 6 minutes will be discussion with the examiner. So the examiner will ask the candidate to identify the clinical signs from the video, and candidate will summarize the findings to the examiner. Then and also you need to tell what is the most likely diagnosis, and also give at least 3 to 4 differential diagnoses. It's very important. Always give most likely diagnosis and followed by 3 to 4 differential diagnoses. And there will be a knock at the door that 3 minutes are left. In the next 3 minutes, you can discuss with the examiner the diagnosis and the management planning. And at the end of 9 minutes, the helper will announce that the station is over and the candidate will move on to the next station. This is how the candidate information sheet looks like when the candidate is waiting outside the station for the first 3 to 4 minutes. For example, it will be like this: you are a pediatric ST4 trainee. You have been asked to see a 4-year-old boy who has presented to the emergency department with a short history of difficulty in breathing. He has a temperature of 40 degrees centigrade. The video has no sound. The video is 49 seconds in length. So the sound is there in the video clip. It will be mentioned in the candidate information sheet, and also headphones will be provided. So you have to use these headphones. So these are the questions asked by the examiner in the video station. So what clinical signs you have observed, and what additional history you would like to take, and what additional clinical examination you would like to perform to arrive at the diagnosis. What is the most likely diagnosis, and what is a differential diagnosis. So each domain has 2 marks, so total 6 marks for the station. 9 minutes and 6 marks. And for domain, what investigation you would like to perform, and how would you manage this patient, management planning. So the 3 domains are C, D1, D2, identification of the correct clinical signs, and clinical reasoning, and management planning. So this is how the mark sheet of the video station look like. The candidate number here, write the candidate name and the date and time. This is the domains which the examiner will use it for marking. So the top tip for this video station is identify the clinical signs and give the most likely diagnosis, and also explain at least 3 to 4 differential diagnoses with clinical reasoning, and discuss the management planning. So this is all about the 10 stations in the examination circuit. So if you have at the end of, after completing all the 10 stations, you will be asked to return to the candidate waiting area. Here the senior examiner will arrive to ask all candidates if they have any concern. If the candidate has any concern, he can raise it to the senior examiner at this meeting. If still you have any concern, and you can just submit a formal complaint at this Mrcpch website. You can email the Mrcpch clinical exam team at this mail within 72 hours of the date of the exam. So as of 1st September 2024, there are up to 6 attempts to each part of the Mrcpch exam. This is a recent change in the number of attempts in the Mrcpch examinations. So the general rule is Mrcpch is not actually testing for the outstanding candidates. They want safe doctors more than the knowledgeable doctors. Okay, so you have to prepare yourself accordingly. Not reading more, but you have to practice more. And you should allow plenty of time to reach the clinical exam center. It's better always to stay nearby the exam center so that you can easily go to the center the next morning or the afternoon according to your session. And once the circuit starts, it will be almost impossible for the candidate to get in. So the exam day instructions and what mistakes to avoid on the day of the exam. So first important thing is you have to arrive early, be at the center on time, and you have to dress appropriately as if you are in the normal hospital setting. And you need to carry the essential items like admission document. Admission document will be mailed by the Mrcpch at least 3 to 4 weeks before exam. You have to take a printout and carry along with you. And ID proof, they will ask the ID proof with the photo and the signature. So passport would be the best. And stethoscope. And stethoscope is usually allowed. Even if not, sometimes stethoscope will be there at every station wherever required. And pencils will be given at the center. If you carry, it's okay. Even if you don't carry, don't worry, because they will provide anyways at the center. And you need not bring the developmental toys or any other knee hammer or measuring tapes. You need not bring all these things because everything will be provided at the station itself. So always better always is to stay nearby the center to avoid last minute rush. So what you have to do during the exam is always follow the correct circuit map very carefully. Each candidate will get a personalized circuit map for the 10th station. So time management is very crucial in this exam, and always pay attention to the examiner's instruction and follow the task very carefully. Avoid rushing through the stations. Always stay calm and systematic and be very organized, and don't do overcomplicated answers, and be concise and to the point. And be patient and listen to the role player, listen to the patient very carefully, and be ethical and have a professional behavior at all the stations. So on the day of the exam, when the candidate arrives, they will be given an envelope like this containing a personal route plan regarding the exam circuit, and the set of the mark sheet you will be given. I have shown you how the mark sheet looks like for each station. So in all the 10 stations for the mark sheets, you need to add your name and the candidate number. Candidate number will be provided in the admission document. So you need to enter this and put these mark sheets according to the order of the station in the route map, so that there will not be confusion. So you need to give the correct mark sheet to the examiner at the correct station. So the final tips for this exam is you have to be very confident, and confidence comes with practice. So practice makes perfect, and time management is very crucial, and you need to join a study group with your friends and practice every day, and so that you can work on your mistakes and avoid those mistakes on the day of the exam. And stay updated and go through the recent changes in the guidelines and recent updates, because that can be asked in the exam. So that's all about this session today, and if you have any kind of questions, you can just mail me, or you can put a WhatsApp message on this number. Okay, thank you so much, and take care and all the best.